Good morning, student. Today's topic is on euthanasia. What is euthanasia? Euthanasia is a process of a painless death to somebody who is actually suffering from a non-curable disease, right? What this means is, for example, a person may have cancer, advanced cancer, and he's suffering from the pain from a cancer, and he knows that the cancer is not curable and he's going to die sooner or later. So euthanasia is a process that the person requested that he can have an early death so that he doesn't have to suffer so much from the cancer. Euthanasia is different from murder, where murder is an intentional killing of somebody. In euthanasia, the patient himself actually wanted to die and not forced death by other people. There are two kinds of euthanasia. One is passive and one is active. Passive euthanasia is a process where we actually remove the active management of the person and let the person die naturally. For example, a person may be who has suffered from a head injury due to a road traffic accident and he's in coma. So this person is actually hooked on to a life support machine like those ventilator, and if we know that the person is actually have no chance of living, he's no chance of recovering, a passive euthanasia is where you stop the machine and let the person die naturally, right? If the person doesn't die naturally, we just let it be until the person eventually dies off. Active euthanasia is a bit different, where it is an active process of causing death to the person by injecting a certain type of poison or chemical so that he can die immediately. The movement of euthanasia has started for many years, right? And there are some doctors who are actually proponent euthanasia. One of them is in a photo here, which is Dr. Jack Kevorkian in US, and he has performed euthanasia on many of his terminally ill patients so that they can die peacefully. But because euthanasia is actually considered illegal in US, and he was actually charged in court and was actually sentenced to jail. Now, what are the proponents of euthanasia? There may be people who say that euthanasia is useful. People who propose euthanasia is useful will say that only the patients can determine, right, whether he wants to live or die, right? So it's not the family members, but it's the person himself. However, there are other people who also argue that terminally ill patients are respected more by having their suffering ended instead of being kept alive against their will. So let's say, for example, the person who is suffering is actually unconscious, right? So his family members felt that it's better to have suffering to end his suffering. Additionally, a utilitarian argument can be made about the harms to the whole of maintaining the individual beyond viability, right? So this is one ethical issue that they can argue that since a person is not going to live, right, so they propose euthanasia because it can actually reduces harm overall. And of course, if you look at the society as a whole, if a person who is not meant to live is able to die off earlier on, you actually can save medical costs. But there are also other people who are against euthanasia. Why are they against euthanasia? Number one, the law itself may not allow euthanasia because euthanasia is considered killing. There may also be a religious objection. Most religion actually against killing people. So euthanasia is actually a process of killing somebody. So religious belief is like you should let the person die naturally. And of course, there are also other objections and family members who objects to having euthanasia because it may be that the person may not want euthanasia, but his family members who wants this person die off so that to save overall costs. So euthanasia can be criticized as a unnatural interference, right, to a normal natural process. So a person will live and die naturally. Euthanasia is actually unnatural because you are actually causing death of a person prematurely. Example of religious reason, alright. Many people object to euthanasia on religious ground because they believe that religion absolutely prohibits all form of killing. Alright. Well, so in this aspect, people will say that you should not perform euthanasia because this is against what the religious teaching is. Now, having considered the pros and cons of euthanasia, we should also look at some of the ethical concerns surrounding euthanasia. First, you must see that who actually suggested the euthanasia. If it's a patient who's suffering, say, I want to die off, that may be better. If it's a family or doctor who suggests it, then you must need to see where is there any ethical constraint there? Is there any ulterior motive? For maybe the family wants this person to die early so they can take his property. Maybe the doctor wants this person to die off because he doesn't want to treat the patient anymore. Right? So you need to look at this and see that who is the one who suggested euthanasia in this aspect. Well, what is the current situation? In many countries, euthanasia is still illegal. Like what I mentioned before, Jack Kevorkian was actually sentenced in jail. Alright, there are actually other alternative euthanasia, which is a hospice services, where the doctors will actually relieve pain of the patient without causing death itself. So that is actually a good alternative for euthanasia. So some of the issues we need to think of is it right to perform active euthanasia to someone who is terminally ill and requests to die? Right? Now, we know the difference between active and passive euthanasia. So do you think passive euthanasia is better and active we should not condone it? And of course also, do you allow the patient to request for it, or do you also allow family members to request for it if the patient is unconscious? So these are some of the things that you need to consider about euthanasia. Thank you.